Welcome back here to Fox 51 today. There's so many great programs here in East Texas that Trinity Mother Frances Hospital offers to the public for those in need. That's why we're joined by Denise and Dr. Phillips here to talk about the Therapet program. Guys, welcome here to Fox 51 today. We're so glad to have you. First of all, Dr. Phillips or Denise, whoever wants to take this question, give us an idea for people who are unaware what the Therapet program is all about, what it is and what it involves.
Therapet is a program that we serve in all the hospitals locally in visitation programs, and we also work in the rehab settings with patients that are rehabbing from different illnesses.
And Dr. Phillips, let's talk about some of those patients. What are some of the ailments they may have to want to get involved in the Therapet program?
Right. Well, you know, we're not just involved in visitation, but the actually animal-assisted therapy. So in the rehab hospitals, we see stroke victims, we see those that are needing to work on fine motor skills or things like that. And the animals just give them a little bit more, you know, just a different way to do some of that rehab. They brush the dogs, they'll, you know, throw the ball, and the dogs will, well, maybe not Sadie because she doesn't retrieve, but they'll throw the ball and retrieve and things like that. And we also do visitations as well.
Now, when you talk about when you go out and find these pets, and are most of them dogs, or are there other animals involved too?
We have a few cats.
Okay.
We actually have one bird.
Okay.
Most of them are dogs, though.
Now, do patients, do they kind of request a certain type of animal, or do you just find the best fit for that animal for the patient?
Well, we do on a rotation. All the animals that, you know, like Sadie is my personal dog.
Okay.
So all the volunteers use their own personal dogs, and we go through all the training to become a Therapet. And then we sign, it's just kind of, you know, like Sadie enjoys going and laying, basically. So she does good at the rehab hospital. She does good at the reading programs. I have another dog that likes visitation. He likes to go from room to room at the hospital. So it's kind of what best fits your dog.
Now, I might be a bit naive, but I know some friends who have dogs and they're not quite as well behaved as Sadie. Is it hard to train some of the dogs if a patient has a particular pet that's just really not willing to understand this program? Is that maybe the most challenging part?
I think the animal has to have the right temperament. And once you assess that you're pretty sure it has the right temperament, very calm in all situations, then it's a matter of a lot of lengthy training.
Right. Are there certain types of breeds of dogs or canines that maybe work a little bit better with certain patients? Have you found that at all?
You know, we have everything from a 3-pound Chihuahua to a 110-pound Mastiff mix.
Right.
It really is the temperament of the animal and not just training. Everybody thinks they can train any dog. I've got 5 dogs. Only 2 of them are Therapets because they have the right temperament.
Right.
Yeah.
So some of the things that I know we talked about some of the ailments a patient might have, but what are some of the things that can improve those ailments? What things that they can do with the dog? Just brushing and petting the animal? What are some of the things they can do?
Well, in the rehab setting, a lot of times we'll let them fetch. You know, you'll have the patient.
Sadie doesn't want to do that, but
no, some do. The patient will throw something, and then the dog will fetch it for them. Or sometimes just standing. You know, rehab patients want to stand, but they may not be as inspired to stand as long unless they're standing with the dog, or maybe even walking the dog down the hall.
You know, sometimes we take lightly the phrase "man's best friend" in a lot of animals, but you know, this program really takes that to heart, doesn't it? Because it really does become such a bonding experience for the patient and their animal, doesn't it?
Absolutely.
It does. The patients, especially in the hospitals, are missing their dogs, and to bring them in, it really, it's been shown to improve, you know, the healing process and everything. You know, they're missing their dogs. We come and visit, and they just feel so much better. And it's even good for the staff of the hospitals.
Great. And how long usually does it take to train an animal to get into the Therapet program when you find one you like?
It can be close to about a year.
Okay, but it's well worth it in the end because you have it for years and years. Well, guys, thank you so much. If anyone would like more information on the Therapet program at Trinity Mother Frances Hospital, how can they get that information?
Go online to therapet.org or therapet.com.
Great. Denise, Dr. Phillips, thank you so much for joining us this morning here on Fox 51 today, and Merry Christmas to you both.
And
say to you as well.